Good afternoon, everybody. It is June the 19th. Alan Harris here in the Emergency Operations Center. I want to give you an update on what is going on here related to COVID-19 in our community. We were doing pretty well, actually. A couple weeks ago, we were seeing maybe 3 or 4 new positive cases per day, and over the last few days, over the last week, we've been seeing upwards over 40 individuals COVID positive here in Seminole County. We continue to call individuals, now we're calling individuals every other day, and that is because the numbers have gone up quite a bit. So we're calling everyone every other day. Our monitoring cases and our COVID positive cases here in the county. It has obviously been very busy over the last few weeks. We have been delivering personal protective equipment to assisted living facilities and nursing homes. So let me talk about some things that are relatively good right now, and because I think we need to have some positive in this situation. So the good is that personal protective equipment is coming in relatively stably. So the state, federal government, and the vendors are starting to catch up on the supply chain. So we're not seeing the long delays in personal protective equipment at this point. We are still delivering, of course, personal protective equipment to ALS nursing homes as they need them, but no one has gotten close to running out like we were maybe 2 months ago. Can I turn that down just a little bit? I hear myself actually just a little bit away from here, so thanks. So that's going relatively well. This is not something that I would call relatively well, but our numbers have obviously gone up quite a bit. The age range that the numbers are in are people that typically rebound and recover from this relatively well. So I wouldn't say that's a good thing, but it's not good to get the virus, obviously. But these individuals recover better. So of people that are going to get it, if you're going to get it, I guess these people end up recovering much better. So what does that say for the rest of us? And that is that we need to just be careful, right? We need to be careful when we go out, and I also want to stress that since the very, very beginning of this, Chairman Zimbauer and I had multiple conversations, and we wanted to make sure, and we have, in most every Facebook Live and most every press conference, that we say it is okay to go outside and take a walk around the neighborhood. It is absolutely okay to enjoy a walk in the park. We are Florida's natural choice here in Seminole County. We have beautiful places to hike and bike and things like that. We don't want people to be cooped up in their homes. We understand disaster fatigue. I understand that very well, as I've dealt with you. I've dealt with disasters here in Seminole County since 1998. So I understand that. I've been to other disasters in other parts of the country. So I understand disaster fatigue. So we want you to be able to get outside, take a walk, take a hike, bike, things like that. Most all of our businesses are open now. It is safe to go patronize businesses as long as we do it safely. We can see these numbers decrease when we do contact tracing, and when I say we, the Florida Department of Health Epidemiology Department, when they do contact tracing, they're identifying these new cases as individuals that are not social distancing freely. They're saying we did not social distance. We made a mistake. We went to a bar and they weren't wearing any facial coverings or masks. The bartenders weren't. The servers weren't, and that's what we're seeing when we ask these questions. So it's important for us to do that. So I just want to say, there's so many people on there. Thanks so much, Bill. Thanks for what you've done, Bill, with the Memorial Day and the events around Memorial Day. I want to thank you and your wife for what you've done to help us. Michelle, hello. So last week we did some testing. So obviously what's not good is the numbers, right? The numbers are continuing to go up. We did have a large number yesterday, so let me explain the number yesterday. We've been seeing over 40 new cases in Seminole County each and every day. We had 121 that populated yesterday. What happened was a lab pushed all of their test results at the exact same time. Instead of them coming in, trickling in over a 3-day period, they dumped all at the same time. So we got 40 cases just all at one time. So yesterday wasn't worse than every other day. It just was a compilation of 3 days before. So what we should have been seeing is around 50 cases each and every day for the last 3 or 4 days. So yesterday, I don't want people to panic because yesterday we're at 121 and that's what's going to happen from now on. What happened was a lab dumped 40 plus cases all at the same time. So we didn't see 121 cases come in just yesterday. It was actually less than that. Okay. 2 weeks ago, we did testing at Sanford Middle School, and we did testing at Winter Springs Senior Center. And the tests were from 9 to 5, and we didn't get a lot of folks to come out. We were thinking, wow, maybe we're going to drop down to one drive-through test site a week. At that point, we were seeing maybe 2-3 new cases a day. And this last week, we of course scheduled a test down at Carolina Elementary School. We knew that there was a hot spot down there because we were starting to see the numbers were jumping up quite a bit. So we tested at Carolina Elementary School, and as we were driving over to Carolina Elementary School, I even spoke to the folks in the car that said, we said, I wonder if there's going to be a lot of people there. We're not really sure. So we pulled up. We were very shocked. The line was down the road. We said, well, clearly there's a demand. We definitely need to do some more testing. So I'm happy to say next week we will do testing every single day of the week. We're going to do testing Monday. I'm looking at another screen. Testing Monday at Winter Springs High School. That's from 9 to 1. It's a drive-through site. On Tuesday, we're going to have 2 locations. We're going to go back to Carolina Elementary School, and we're also going to be at Winter Springs High School. The Winter Springs High School on Monday and Tuesday are reservation required, so you must register for that. You can go to prepareseminole.org to register for that. On Wednesday, we will also be at 2 different sites. We'll be at Lake Brantley High School. That is first come, first served, 10 a.m. to 2 p.m. And then we will also be at Lake Mary High School, and we will be at Lake Mary High School also on Thursday. Those are reservations only, reservations required. And then Friday we'll be at Bentley Elementary School. To get a list of all of those, go to prepareseminole.org and click testing, and you can get a list of all the sites, and those that are you need to register for, just go ahead and do that. Laura asks, is it important to wear a face mask? Yes, it is. The CDC has said this. There are multitudes of studies out there, and some of them saying that this may be the single most important thing that we do during this pandemic is to wear a facial mask and covering. There's one study out there that says we could eliminate the spread by 80%. I'm sorry, if 80% of the population wore facial masks and coverings, we could severely diminish the spread of this virus. So we have strongly encouraged social distancing. We have strongly encouraged the queue lines. We even had an executive order related to that. At 2 o'clock today, our executive group will meet again to discuss executive orders. We'll meet to discuss the requirements of facial masks and coverings in our community. We have medical doctors, we have some hospital administrators, all that will be talking to us about what they're seeing. So this is going to be something that is heavily discussed at our 2 o'clock meeting. But that is even if we don't, Orange County put out an executive order yesterday. It's a voluntary executive order. So. All right now we're asking, please, people, wear facial masks and coverings. It is important. We've been saying that for a while now. CDC says that. The White House medical team says that. So there's a lot of folks out there that's saying that. Kyle asked, how are antibody tests counted? Those are tested separately, completely separate. So they are not tested with the other tests. So they're not combined together. I know there was some misinformation out there. Our friends down at the Orange County Health Department, Dr. Pino, mentioned that they may be combined. He immediately corrected that the next day. So Laura asked, Avito has the worst spread. So in our dashboard that we put up on our website, prepareseminole.org, you can go and see the heat map, and you can see where the hot spots are here in Seminole County, and you can see the map, and the map will clearly indicate where the hot spot is in our community. Amanda asked, what's the positivity rate? So the positivity rate has gone up. So the positivity rate continues to increase. And some people said, well, you're getting more positive tests because you're testing more. No, the positivity rate's gone up, so that's a completely false narrative. It's a false comment that is the case. The positivity rate is going up, and what we're seeing is the percentage of individuals that are being tested are coming back more positive. Pippa asked, who decides if we wear masks? Well, you decide, right? So we encourage every single person to wear a mask. Again, the CDC, the White House, those types of medical teams, medical professionals have said facial masks and coverings will protect others. So you make that decision. I think that's a very important decision to make. Lots have made... you're right. Some folks have started to put out the facial masks and coverings requirement. I know the Keys did it. Broward, Miami-Dade, Hillsborough is looking at it later. Orange County, I know Sarasota County is looking at it. So we are looking at it too. Again, we meet at 2 o'clock to discuss it. Amber asked, why are bars with outbreaks of positive cases? A lot of those have they've closed themselves. They've actually decided themselves to go ahead and close. And we're working with a couple right now. The owners made a very difficult decision to close their business. It's either because the patrons had called and said, hey, I'm sick, or the staff members. Now, I will say that each one that I've talked to has said the servers and the bartenders were not wearing facial masks and coverings. Each and every one that I've talked to also, and the health department as well, this is echoed, because they talked to some of them, I talked to some others, that when they open, they plan to wear facial masks and coverings. So certainly that is a lesson learned from those business leaders. And again, the county didn't say, the health department didn't say, the Department of Business and Professional Regulations didn't come in and tell any business to close. They self-closed because of the patrons and because of the employees getting sick. Cheryl asked, can we see the antibody statistics?
They're on the DOH website.
Oh, okay. So if you go to the Florida Department of Health website, you can pull up the antibody statistics, and it pulls up every Friday. That's right, updates every Friday. So you can go to their website and you can get an update on the antibody test. Brian asked, how effective are homemade masks? Well, we asked for what's suggested is at least to have 2 different materials. So our mask here that I wear, this is a pretty cool mask. It's got our logo on it and stuff like that. We bought it for really cheap. It's got 2 different cloths on it. So it prevents, again, when we wear a mask, we're really protecting other people, right? So we're just sharing our care for other people. We don't know who that person is in the line next to us. They could be a cardiac patient. They could be a diabetic, whatever the case may be. Our last 2 fatalities, we did get 2 fatalities over the last week. Our last 2 fatalities, a 52-year-old male, he had a diabetic history, and the 53-year-old male, and he had a cardiac history. So we want to protect those individuals. And how can we protect those individuals? This thing right here. Okay. Susan asks, what is done when a business is in violation of the rules regarding masks, like salons? If someone notices that that's the case, certainly call the Seminole County Sheriff's Office, 407-665-6650. Again, 407-665-6650. You can just let them know that this particular business is not following the state governor's order related to the hair salons, and that'll just be pushed over to the Department of Business and Professional Regulations, and then they'll make whatever decisions they need to make. Brenda asks, is testing only 18 plus? So for our pop-up test sites, yes, but you can go to a pediatrician's office and you can get a test under 18, but for our test site, it is 18 and older. Nancy asks, when will the results come in from the Carillon? We're expecting results anywhere from about 3 to 7 days that we start to see those results come in. Hopefully a little earlier. With the lab they were using for that one was LabCorp. So they typically, LabCorp is a really good lab that has been returning in relatively short order. So maybe 2 to 4 days. So hopefully 2 to 4 days we'll start to see some of those tests start to come back. Allison asked, how frequently do the labs input numbers? So normally, it depends on the lab actually. It can be anywhere from 2 to 4 days. Some of the labs are a little bit lag, so some of them can be 4 up to 10 days. So, but normally we see like 4-6 days when we start to get the information here and we start calling the individuals. It's normally about day 3 or day 4, so that can give you some type of idea. Brenda asks, will more pediatric tests be available before school resumes? Yeah, we are actually working on that right now. We've been working on that, but certainly if you have anyone that is concerned, or if you are concerned, certainly call your pediatrician, see if they can arrange that for you. Annie asks, can you help the community understand why masks aren't mandatory? So we did issue a mandatory mask for individual and businesses that were within 6 feet of each other. That is certainly something that we're going to discuss at 2 o'clock. We're going to discuss other types of things as well. We wanted to do public education and information. We were hoping, just seeing the numbers, that more people may be interested in supporting the community by wearing facial masks and coverings. We were hoping that would be the case. So we took our the facial covering and mask, the social distancing order down when we went to phase 2. That was our plan. We thought that things were doing better. I think the governor thought things were better. Everyone really thought things were getting a little bit better. We were only seeing 2 or 3 cases a day. I mean, it seemed like we were right on the right track. The numbers had gone down. You can look at the graph and see we were way down. Everything looked pretty stable, and so we decided, well, we'll go ahead and rescind this thing. And then unfortunately a week and a half later this happened, so we're certainly looking at it again. Miranda asks, protocols for sports outside. So we're still moving forward with our tennis camp next week, but no shared equipment, so you can easily relatively social distance on tennis camp, because you're way far apart from each other, so you can do those types of things. Certain sports activities obviously are going to be more risky than other sports activities. So if you get right in the face of someone, that's one thing. But if you're playing tennis, that's obviously a much safer type of sport. So just before you determine what type of sport you want to play, you may want to just look at how risky it's going to be. Let's see. Pippi asks, when can I get an antibody test, or where can I get an antibody test without insurance? At the Orange County Convention Center. That's the regional test site for antibody testing. I don't think they're charging over there. So you can go down there and you can get a test. Are they doing the finger prick or are they doing the blood draw?
Blood draw.
Okay, so it's a full blood draw there at the site. So you can go down there and they're doing. They have an antibody line and a COVID line. So you just get in the antibody line and you can go and get your antibody testing for free. If you don't, if you have insurance, you can go to other and we have a whole list of antibody locations by going to prepareseminole.org. It's got its own bullet there, so don't click the testing bullet. Click the antibody testing bullet, and it'll give you a whole list of antibody testing locations. George asks, when will the county make the countywide face mask? Same thing. We're going to discuss it at 2 o'clock. Jennifer asks, if I'm required to wear a mask at work, customers and clients should be required to as well. Can't disagree with you there. Brittany says, what capacity are Seminole County ICUs at this point? So right now we have, we just changed the dashboard. Some of y'all had asked about persons that are being tested for COVID and also in the hospital. So we added that box. So for those that wanted that, right now we have now this is important to note, on our dashboard we only talk about Seminole County hospitals. So some of our residents obviously have gone to ORMC downtown, they've gone to the VA hospital, so it's just a picture of the hospitals in Seminole County. But in Seminole County, we have 56 individuals that are in hospitals right now related to COVID. 30 of those have tested positive for COVID. 26 of them are currently being tested and have those types of symptoms. Currently, the availability count I'm looking at of hospital beds is about 17%. So that's the availability, but I think that it's important for us to explain what that means. So that's the hospital beds, and that means that, remember, we have waited a while for some of these surgeries, these elective surgeries and other those. So now they're trying to catch up, right? So that doesn't mean 56 people obviously are not taking all the hospital beds in all 4 hospitals. So the percentage is slightly skewed because there's a lot more surgeries going on. All those elective surgeries are now taking place. So that's. Sandy says, thanks for the daily updates. We tried to change it a little bit, the dashboard, so I hope it's helpful. We're trying to provide y'all a little bit more information. We tried to make it a little bit cleaner. The public information team has just really gone out of their way to try to provide good public information to you all. So I hope that y'all are getting some good information out of the dashboard. Leon asks, is the Orange County order is mandatory and enforceable with fines and prisons? No, nothing on their executive order says there's fines and prisons. Kelly asks, how long do test results normally take? Again, 2 to 4 days, could be up to 10 days for that. Kelly, please reiterate the percentage increase, not increase in test. Oh, yeah. So you're right, Kelly. The increase is the increase in the positivity. So, okay, so let's go back. So 3 weeks ago, we were testing at 3 different sites. 3. We were at the Altamont Mall, we were at the Seminole Town Center Mall, and we were at a pop-up site. And so we were doing about 250 to 300 tests a site every single day. 3 weeks ago, there was just not the need. There wasn't the demand. As I told you, we had 2 sites and we barely got 150 people at one of the sites. And we did get more at the other site, but not a lot. So instead of 4 weeks ago, maybe 5 weeks ago, where we were testing over 3,000 people a week, 2 weeks ago we tested maybe 400. So obviously a lot less. The percentage of individuals that are positive are coming back higher. The individuals, and just remember when you were a college student or the college age, did you just go and get a test? We were hoping that the Carolina Elementary would bring out a lot of that age bracket, and it did bring some, but not what we had hoped. These people, the individuals, and we've talked to them. They were sick. they went to the doctor, and then they got a test, and they came back positive. It's not because of these pop-up sites. It's not because they were feeling great and they thought, oh, I'd like to go get a test. They felt bad and they went and got a test, and that's how that we learned about them. What happens when a business gets reported to non-compliance for a state order? That is completely up to the Department of Business and Professional Regulations. I don't know what all they do. I guess they could pull a license, they could fine, they could do other things. So that would really be up to them. That is not something that we do. We're not licensure agencies for those industries. Taisha asked, where can I get a test on the weekend? We were doing some tests on Saturday. I will see what I can do to get a test on a Saturday, a test site up on a Saturday. I couldn't do it this week and next week, but I will try to get another test site up on Saturdays. We were doing them on every Saturday, but we will start to do that again. Brett asked, are gyms required for staffs to have masks? That is... Yeah, there's nothing in the state executive order that says that, would it be advisable? Sure, but there isn't currently a rule for that. Ashley asked, antibody tests available at the pop-up sites? Yes, they are. So we are close to 1:30. I hope I was able to provide you a little bit of information. I hope y'all get some good intelligence out of the dashboard. We've been trying to provide, hey Amy, try to provide a lot of good information to you. Thank you, Diane. I appreciate I appreciate the great comments about the dashboard, and we'll continue that. It seems like everybody is getting a lot of good information about that. Josh, I appreciate it. Thanks so much. Really appreciate that. So let's see. Kara asked, are hairdressers and clients getting COVID? Oh, yeah. So most of them have been related to a bar and things like that. So and again, restaurants and things like that. And again, all the restaurants and the bars and places that we've talked to, where it's been a challenge is when the servers and bartenders, and again, this is from the owners themselves, when the bartenders and the servers aren't wearing masks. So that's what we've seen. That's just the facts. So. But anyways, we're near 1:30. I hope you'll have a safe and healthy weekend. I hope this has provided you some good information. We will put out, even if, again, from the very beginning we've said this, right? Frequent hand washing, social distancing, queue lines, making sure that there's 6 feet in between at the queue lines. Wearing facial masks and coverings, that was added, of course. At the very beginning, we didn't have that. We learned more about the virus. So now the CDC, the Surgeon General, have all said this is it may be the one really strongest thing. So we're encouraging everyone: facial masks, coverings, washing hands frequently. If you're home, if you're not feeling well, don't go and go out in the community. If you do get sick, get a test. And don't leave the house. We provide services. We're one of the few counties here at the EOC that will, we're helping people get food. We're helping people so they can stay at home so that we can prevent the spread of this virus. I hope you all stay safe. I hope you all stay healthy. Really appreciate y'all's support in helping to. We will get through this. We have been through hurricanes. We have been through floods, we've been through tornadoes, we've been through all types of things, and we will absolutely get through this together. We are a resilient community. Seminole County has gone through a lot, and we continue to be resilient, and we will be resilient here. The PIO team will answer the questions I couldn't get to. So again, I want to thank you all for being online today, and I hope you have a blessed, safe, and healthy weekend.